first video in our anatomy series. Today we are going to be diving into the specifics of the thoracic cavity. And if you're sitting there thinking to yourself, what is the thoracic cavity? We're going to talk about it today. So you will leave after this video knowing what the thoracic cavity is, and not just what it is, but what is inside of it. So let's get started, shall we? The thoracic cavity is divided into three large spaces, the mediastinum and the two pleural cavities. So here's a coronal section, anterior view. We're looking at a cross section here. So here's the right lung in the pulmonary cavity, the left lung in the pulmonary cavity, the inferior mediastinum. Here's the thoracic outlet, and that's where the diaphragm sits. And then the thoracic inlet is up here with the superior mediastinum. So let's talk about what are the major structures in the area. So the mediastinum has a superior and inferior portion, as evidenced by the fact that we had the superior and the inferior portion. So what's in that superior portion up here? The thymus, great vessels being the vasculature vessels, we'll talk about those. The trachea, the esophagus, and the thoracic duct, which makes sense because the thoracic inlet is right there. The inferior mediastinum has an anterior, middle, and posterior portion, so subdivided even further. The anterior portion, or the front, is going to have the thymus, especially in children. The middle is going to have the heart, the pericardium, and the roots of the great vessels, which are going to come up into the superior mediastinum. And then the posterior portion has the thoracic aorta, the thoracic duct, the esophagus, and the azygous venous system. So we'll be seeing all this soon, but we at least can kind of talk about what we can expect to find where. And then, pretty straightforward. Right pulmonary cavity, right lung. Left pulmonary cavity, left lung. Checks out. Good to go. Alright. Now down here we've got an open thoracic cavity with the thoracic wall removed, as well as the connective tissue of the anterior mediastinum. So this is a very busy picture, but it's going to have everything that we'll be talking about today all in one place. So everything will eventually end up coming back to this picture indirectly. So there is that thyroid gland and thyroid cartilage. We've got the phrenic nerve, which, as you know, goes down to the mediastinum. The recurrent laryngeal nerve, which actually goes to your vocal cords, so you can speak. That's how you're enjoying this video right now. You got the brachial plexus, which will be a video unto itself. It's a very complicated, it's a very straightforward but intricate set of nerves that innervate your whole arm and like upper shoulder. It's very cool. We'll get to it though in another video. We've got the left vagus nerve, and then the left subclavian artery and vein in here. The internal thoracic artery and vein hanging out in here. Here's that first rib, just to orient ourselves. So it means the sternum has been cut away too, so that we can see. The left brachiocephalic vein here. The aortic arch is here. The left vagus nerve here. Left pulmonary artery is here. The parietal pleura, the mediastinal portion, is right here. And that's just basically a protective layer around the heart. Left lung, pretty straightforward. Right lung, pretty straightforward. And then the pericardium. Remember, peri is before or outside. So outside the heart, pericardium. It's just a layer of connective tissue to protect the heart from any kind of injury or anything like that. We've got the parietal pleura, the diaphragmatic portion. And then the phrenic nerve, the pericardial branches here. The I did it again. I did this last video. Pericardiacophrenic arteries and veins, along with the pericardial branches here. One of these days I'll get that word right. And then the pericardiacophrenic arteries and veins and nerves. So we got branches down here, and then the main supply up here. Here's the thymus, which as indicated up here, is especially seen in children. So the thymus is actually a gland that is quite large when you're a child and progressively shrinks in size as you get older and older. The superior vena cava, the right brachiocephalic vein. Here's the right vagus nerve, the trachea itself. Here's the anterior scalene muscle, right phrenic nerve, and internal jugular vein. So, a lot of structures that we'll be talking about quite a bit today, but I figured it would be good to kind of an overview of what to expect. Here's the divisions of the mediastinum, and we've got a mid-sagittal section, lateral view, so we're looking at it from the side. Our person is facing forward this way. So, cervical portion of the esophagus, the cervical portion is right here, and then the thoracic portion is right here of the trachea itself. So trachea lays in front of the esophagus, and so this kind of shows the relationship here between the trachea and the esophagus, how close they are to each other. So if you hear somebody taking a drink and they start to choke and they say, "Oh, that went down the wrong pipe," that means that the fluid started to go down the trachea to the lungs where it shouldn't, as opposed to the esophagus down to the stomach. Here's the thoracic inlet, and then the thoracic portion of the esophagus. Here's what's considered the posterior mediastinum. This would be the middle mediastinum, which is basically the heart, and then the anterior mediastinum hiding behind the sternum, and then the superior mediastinum here too. And we've got a transverse section, inferior view, so we're down below looking up in. Here's the sternum to orient us. Here's the thoracic vertebrae to orient us. Here's that descending aorta and the esophagus, the middle mediastinum, the anterior, and then we can see the posterior mediastinum here, and then right lung, left lung. And the reason that this shot is helpful is because there's a direct corollary here. This is a radiographic image of what we would see here, and a couple identifiable features from the inferior mediastinum. We've got the inferior vena cava here, and then the esophagus we can identify faintly right here. Azygous vein we can actually see, and then the descending aorta. So, two major blood vessels right there. And then this is a transverse section of the thorax. So we're looking top down, and then we can see the inferior vena cava just above the level of the heart, the descending aorta. We've got the esophagus, and then the right and left main bronchi. So those are your main airways right before they reach the lungs. Let's keep going. Alright, so we'll have arteries, veins, and nerves of the thoracic cavity. That's what we can expect over the next couple pages. It says the arch of the aorta has three major branches: the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. After the aortic arch, the aorta begins its descent. So let's see if we can track with us here. The arch of the aorta has three major branches. So here's that arch. The brachiocephalic trunk. Let's find that. If we can, yeah, there we go. Brachiocephalic trunk. The left common carotid artery. Where is that at? I'm trying to find the little arrows that go with it. There we go. So the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. Those are the three features coming off of this arch. So brachiocephalic trunk, left common carotid, left subclavian. After the aortic arch, the aorta begins its descent, becoming the thoracic aorta. So it's coming up out of the heart and then going down, becoming the thoracic aorta at the level of the sternal angle, and the abdominal aorta once it passes through the aortic hiatus down here in the diaphragm. So let's see what some of these arteries are. We've already talked about the left subclavian, the left common carotid, and the brachiocephalic being those three branches coming off. But we've got the right common carotid and left common carotid, and then changes, features of note, the thyroid cartilage and the trachea, that anterior scalene muscle, middle scalene muscle, just showing relationships here. It's a big part of what anatomy is in general. We got the right vertebral artery, right subclavian artery, and internal thoracic artery. There's that first rib. We got the right main bronchus and the left main bronchus. The esophageal branch right there. So the esophagus needs blood supply too. And then the posterior intercostal arteries are in here. The diaphragm itself, and then the inferior phrenic artery, which makes sense, it's below the diaphragm, feeding the diaphragm. The celiac trunk, which is a big deal for some of the abdominal features that we'll talk about later. And then the lumbar artery. Those are all part of the abdominal aorta coming out of the aortic hiatus. Here's the thoracic aorta because of where it's at. We've already talked about a few of these. We got the bronchial artery hanging out right here. So it's giving blood supply to the bronchi. And then, yeah, the only other thing really of note is that esophagus and the thyrocervical trunk right there. Okay, branches of the thoracic aorta. So we're in this section right here. But it says parts of the aorta, left lateral view. Note the aortic arch begins and ends at the level of the sternal angle, which, as you might remember, is that little notch in the sternum. So we've got the trachea and the esophagus, trachea and the esophagus. The left common carotid artery, the left subclavian artery. Just trying to show it in the grander scheme here. The aortic arch, the ascending aorta, and then the descending aorta. We've got the left pulmonary artery, which we cannot see in this picture. And then the left main bronchus and the pulmonary trunk. Alright, so the branches of the thoracic aorta. Back in this section now. The thoracic organs are supplied by direct branches from the thoracic aorta as well as indirect branches from the subclavian arteries. So, brachiocephalic trunk gives you, let's find that again. Brachiocephalic trunk right here. Gives you the right subclavian artery. It gives you the right common carotid artery. And, yeah, that's right. And then the left common carotid artery comes off of that thoracic aorta. And these both help supply the head and neck. Oh, the left subclavian artery being part of the brachiocephalic trunk, it's giving you the information here. So the left common and the left, the left common and the left subclavian both help supply the head and neck. But more specifically for the left subclavian over here, it's going to give you the vertebral artery. It's going to give you the internal thoracic artery, which supplies blood to the anterior intercostal, thymic branches, mediastinal branches, pericardiacophrenic artery, inferior thyroid, and superior intercostal artery. Basically, whatever's in that area is going to get some love for the internal thoracic. Really, it stops with those three, sorry, but the thyrocervical trunk gives you the inferior thyroid. The costal cervical trunk gives you the superior intercostal artery. And then, going with the relationships, anterior intercostal, anterior chest wall, thymic branches to the thymus, well named, mediastinal branches to the posterior mediastinum, pericardiacophrenic artery to the pericardium and the diaphragm. And then for the thyrocervical trunk, that inferior thyroid artery, esophagus, trachea, and thyroid gland, superior intercostal arteries to the chest wall, and then from that descending aorta as it goes down, you've got visceral branches that go to the bronchi, trachea, and esophagus because they're right in the area. You've got the parietal branches, which has the posterior intercostal arteries and the superior phrenic arteries. Anything phrenic, you can think diaphragm. Superior phrenic diaphragm, posterior intercostal, posterior chest wall. And then the ascending aorta has the right and left coronary arteries of the heart. So, these in a minute. Clinical box 8.1. Aortic dissection. A tear in the inner wall or intima of the aorta allows blood to separate the layers of the aortic wall, creating a false lumen and potentially resulting in a life-threatening aortic rupture. Symptoms are dyspnea, or shortness of breath, and a sudden onset of excruciating pain. Acute aortic dissections occur most often in the ascending aorta and generally require surgery. More distal aortic dissections may be treated conservatively, provided there are no complications. Example given, obstruction of blood supply to the organs, in which case a stent may be inserted to restore perfusion. Aortic dissections occurring at the base of the coronary artery may cause myocardial infarction. That's a medical term for heart attack. Aortic dissection, parts of the intima are still attached to the connective tissue in the wall of the aorta. Here's that false lumen, and then that's the ascending aorta. So it's going down, and then you've got a false extra capsule basically inside of there. There's that false lumen again, only this time you can see it in the ascending aorta, and then intima. The flow of the coronary arteries is intact. Alright, now we've got veins. And now that we've oriented ourselves with the original picture in the arteries, most of these have a direct counterpart, so we can maybe go a little bit quicker through some of this. I don't want to gloss over anything, but I also don't want to be overly redundant either. So, it says the superior vena cava is formed by the union of the two brachiocephalic veins at the level of the T through T2, T3 junction. It receives blood drained by the azygous system. The inferior vena cava has no tributaries in the thorax. Interesting. So, let's find that superior vena cava right there. So it's at the T2, T3 junction, and it receives blood drained by the azygous vein system. So all of this is eventually leading back to here. So the accessory hemiazygous and the hemiazygous lead back to the azygous, which goes to that superior vena cava. It's all working back up. But let's look individually here. We've got the right supreme intercostal vein in here, the right subclavian, which is a partner to the artery. There's that first rib right here. The right internal thoracic vein, right brachiocephalic, azygous, posterior intercostal. There's the diaphragm. The ascending lumbar veins, ascending because all that blood supply is going up. That aortic hiatus, just to orient ourselves. The inferior vena cava, which is the main receiver of the lower body's blood supply, taking it back up. We've got the left ascending lumbar veins, the lumbar veins themselves. There's the hemiazygous and accessory hemiazygous. So there's a split at about this level here. The left brachiocephalic vein here. The inferior thyroid vein, left subclavian, left external jugular. There's the middle scalene and anterior scalene muscles, and then the left internal jugular vein. Alright, now we've got the thoracic tributaries of the superior vena cava, and what that means is, just like tributaries of a river, it's all going back to one place. So again, home plate is this guy right here, the superior vena cava, to dump right back into the heart and kick it over to the lungs to be reoxygenated. So, got that right and right internal jugular vein, the left brachiocephalic vein, right subclavian, the superior vena cava, the right brachiocephalic vein in here, right pulmonary vein, left pulmonary vein, inferior vena cava. So the brachiocephalic vein receives blood from the inferior thyroid vein. So brachiocephalic, let's find it again. Brachiocephalic vein here. It's going to receive blood from the inferior thyroid, internal jugular, external jugular, subclavian, supreme intercostal, pericardial, and left superior intercostal veins. Now the inferior thyroid takes care of the esophagus, trachea, and thyroid, and then all the rest of these take care of the head, neck, and upper limbs. You've got the azygous system here, and you've got the visceral branches and the parietal branches. The visceral branches take care of the trachea, bronchi, and esophagus. The parietal branches receive blood from the posterior intercostal veins, the superior phrenic veins, and the right superior intercostal veins. And they drain the inner chest wall and diaphragm. And then you've got the internal thoracic veins, which comprises the thymic veins, the mediastinal tributaries, anterior intercostal veins, pericardiacophrenic veins, musculophrenic veins, thymic, the thymus, the mediastinal tributaries, the posterior mediastinum, anterior intercostal veins, anterior chest wall, pericardiacophrenic, the pericardium, musculophrenic, the diaphragm. It says, note the structures of the superior mediastinum may also drain directly to the brachiocephalic veins via the tracheal, esophageal, and mediastinal veins. Here is the azygous system. As you can see, it's pretty involved. The accessory portion, the hemiazygous portion, and then the main azygous vein itself going back to that superior vena cava. Alright, now we've got something that we haven't necessarily talked about a whole lot before, the lymphatics, the lymphatic system. So this is kind of like your city sweepers, your janitors of your body, kind of taking out the trash, the stuff that shouldn't be there. It helps to lead to its ultimate excretion from your body. The body's chief lymph vessel is in the thoracic duct. Beginning in the abdomen at the level of the L1 is the cisterna chyli. The thoracic duct empties into the junction of the left internal jugular and subclavian veins. The right lymphatic duct drains into the right junction of the internal jugular and subclavian veins. And since we've already talked about a lot of these vascular structures, we won't revisit those beyond just the idea of highlighting the lymphatics specifically. So we've got this thoracic duct here, tucked in by the subclavian artery and veins. So thoracic duct is here. We've got the right lymphatic duct here. We've got that thoracic duct here. The cisterna chyli here, which is going to lead to most of the emptying of your lower body. And then, let's see, what else? I think that's, there's the bronchomediastinal trunk. Alright, lymphatic pathways in the thorax, so this is going to be probably a little bit easier to follow, as opposed to everything going on at once. So, right and left jugular trunk, taking care of the head and neck. The thoracic duct, in relationship to the left internal jugular vein. The right lymphatic duct is here. And the left subclavian trunk is here, so it's not a perfect parallel, one side versus the other. But there is commonalities as far as the right bronchomediastinal trunk and the left bronchomediastinal trunk. And then it's got information on what drains where. So the paravertebral lymphatic system is posterior thoracic wall. The peristernal portion takes care of the anterior mediastinum, the anterior intercostal spaces, anterior thoracic wall, and the mammary glands. And the superior mediastinum is taken care of by the brachiocephalic portion. And then the pre-pericardial and lateral pericardial and paraesophageal lymphatics take care of the portions of the heart and the esophagus. The paratracheal lymphatics and the tracheobronchial lymphatics and the bronchial first section at the level of the tracheal bifurcation of T4 superior view. So we're looking down. The thoracic lymph nodes can be divided into three broad groups. Nodes of the thoracic wall in pink, the pulmonary nodes in blue, and the mediastinal nodes in green. And then we will be later in pages 110 and 111 for the details of lymphatics of the mediastinum. We'll talk more about them then. Alright. The last portion for today is the nerves of the thoracic cavity. So plenty to take in here. Thoracic innervation is mostly autonomic, arising from the paravertebral sympathetic trunks and the parasympathetic vagus nerves. There are two exceptions. The phrenic nerves innervate the pericardium and diaphragm, and the intercostal nerves innervate the thoracic wall. There you go. Okay. So we've got the right and left vagus nerves, the right and left phrenic nerves, the sympathetic trunk of the thoracic ganglion, and then they're highlighting the posterior intercostal nerves here through the ribs. Now here's the thoracic innervation. Again, not going to go over the vascular structures. We're going to highlight the nerves because that's what's different. Sympathetic trunk of the middle cervical ganglion. We've got the right recurrent laryngeal nerve tucked away in here. We've got the intercostal nerve tucked in here. We've got the sympathetic trunk, so that it allows for sensation through here. The greater splenic nerve in here. The brachial plexus, so that whole system is in here and goes down into the arms, into the shoulders. The left vagus, the left recurrent laryngeal, again for the larynx, allowing you to talk. Here is the sympathetic trunk over here, and the interior vagus branches. The recurrent laryngeal nerves have been slightly anteriorly retracted. Normally they occupy the groove between the trachea and the esophagus, making them vulnerable during thyroid gland surgery. Interesting. Alright, and now we're going to highlight the sympathetic and parasympathetic nervous system, the contrast between the two. The autonomic nervous system innervates smooth muscle, cardiac muscle, and glands. It is subdivided into the sympathetic, or red portion, and parasympathetic, the blue nervous systems, which together regulate blood flow, secretions, and organ functions. So, relatively straightforward, but requires a certain level of nuance here. You've got the superior cervical ganglion and the middle cervical ganglion, and then the stellate ganglion. coarse ganglionic fibers follow the intercostal nerves and target blood vessels and glands in the chest wall. Those that accompany the intrathoracic arteries have visceral targets, and then those that gather in the greater and lesser splenic nerves target the abdomen. The axons of preganglionic neurons exit the spinal cord via the anterior roots and synapse with the postganglionic neurons in the sympathetic ganglia. Okay, now let's get to the parasympathetic portion. So, yeah, parasympathetic. The origin is the brainstem, and the course is with the vagus nerve, cardiac branches to the cardiac plexus, esophageal branches to the esophageal plexus, tracheal branches to the trachea, and the bronchial branches to the pulmonary plexus, the bronchi and the pulmonary vessels. The ganglion cells of the parasympathetic nervous system are scattered into microscopic groups in their target organs. The vagus nerve then thus carries the preganglionic motor neuron axons to these targets. So, the vagus nerve here, there's a lot happening in this picture that I'm trying to adequately describe. I think that the chart maybe makes it a little bit easier than what I can explain on this here picture. But yeah, ultimately the takeaway is that the parasympathetic nervous system assists with the pharyngeal plexus and the esophageal plexus, which is also receiving from the sympathetic. It also assists the pulmonary plexus like the sympathetic, but it takes care of cardiac branches and the vagal trunks, as well as indirectly the superior laryngeal nerve and the recurrent laryngeal nerve. So a little bit complicated, but I think that the more we go through some of this stuff, the more straightforward it'll be. And I don't want to go into too much detail whenever I know it'll be talked about more later. And with that, I think that concludes the thoracic cavity, because next time we'll be heading into the mediastinum. So, thank you for taking the time to watch this video. If you've watched to this point and you haven't subscribed yet, would love it if you would. I appreciate likes, as always. The likes and the subscriptions allow people like myself to continue to make content so that you can enjoy it. As always, I hope that this is a place that you can relax, that you can escape for a little bit, that you can be educated and informed, or intrigued at least, if it's not something that you're super